Hello and welcome. This is Hangouts with Hive. Today on Hangouts with Hive, Prep Champions will lead the way. Exciting. My name is Yamini Oseguera Bhatnagar, Power Health Coordinator at Hive, which is a hub for positive reproductive and sexual health. It is the 22nd of February in 2017. And I'm broadcasting live from San Francisco, where it's been pouring rain, and so it's taken a toll on me, and that's why my voice sounds funky, but here we go anyways. Why are we talking about Prep Champions, and who are Prep Champions? A couple of things about that. PrEP was approved as an effective HIV prevention tool back in 2012. Prep Champions emerged early on. These are folks for whom PrEP was really a viable option. PrEP implementation in many parts of the country happened in part because of consumers who came forward, folks who created networks, they talked with their lovers, with friends, with partners. Folks talked with their providers. They asked for PrEP, sometimes demanded that PrEP be made available to them. And it's been a true consumer-driven effort from the beginning. What are some things that we can take away from this hangout? We will hear about that from our various panelists, who I'll introduce in just a second. But here are a few things that we can keep in mind as we listen. First of all, disclosure is a journey, whether it's PrEP use disclosure or disclosure of HIV status. It's not a one-time event. If someone has disclosed once, does not mean that they will always disclose, and it also doesn't mean that they're open to being outed when they're not feeling comfortable. We've learned some things from trauma-informed care. One thing we have learned is that we need to look at resiliency-based models and resiliency-oriented approaches to include affected communities in the programs and services that we create and run. We can do more than just having community advisory boards, and we must do more than consulting people and having people's voices as an afterthought. When we ask folks for their opinions, we also really need to be thinking about how to meaningfully include that feedback as we move forward. We pulled this panel together to highlight the work of some of the bravest and most dedicated PrEP storytellers from around the country. It is beyond an honor to be in the same hangout room as these folks. Today, by Christina Palacios, John Byrne, Caleb Barton and Phoebe Van Cleef, Martell Superman Todd, Marvin Alviso, Nicole Trainer, with no more further ado, I'd like to hand over. Actually, I'm sorry. I'd like to say a few things about Hive. All right. Hive has been around for a long time. Since 1989, Hive, which is formerly the Bay Area Perinatal AIDS Center, has provided preconception and prenatal care to women and couples who are affected by HIV. Since 2004, all babies born in San Francisco have been free of HIV. And we are very proud of that. Our mission is advancing reproductive and sexual wellness for individuals, families, and communities affected by HIV in San Francisco and beyond. And our vision is a world where people affected by HIV have safe pregnancies, reproductive autonomy, access to state-of-the-art healthcare, and most importantly, enjoyable sex lives. A couple of tips for our viewers before we delve into the content of the hour. We will broadcast for the next 60 or so minutes. During this time, as you listen to our awesome panelists, please think about questions that you may have for them and ask them in one of two ways. You can either type them right into the YouTube comment section, or you can actually text them to 415-842-2722. That's 415-842-2722. If you like what you're hearing, please hit us up on Twitter, #PleasePrepMe. We'll be on there. We'll be talking about some stuff that's going on here. It's going to be live tweeting. Please join us. Hashtag please prep me. If you're watching this video after the live broadcast is already over, go to the link in the info section for more information on this Hangout and a list of resources that we put together. With that, I'd like to turn over to our first awesome presenter, and that, my friends, is Martell Superman Todd, who is a social media personality who models, posts, promotes, and typically tries to make the world a better place. His work in the world of prep advocacy is something near and dear to his heart, which is why not only does he educate, he's a content as well. Martell, welcome, and thank you for being with us.
Thank you. Thank you. Can you hear me? Does everyone hear me? Okay, great. I appreciate it. Thank you, Yamini, for an awesome introduction. Thank you for hosting a great discussion about a very, very important topic. I think that in reference to some of the things that we were talking about in conjunction with this discussion, I think it's critically important that people that are out in the world and know you and know your status and know that you're on prep or not, it's very, very critical that more of us take that stigma away. The stigma of, oh, well, you know, this person is very promiscuous because they are on that type of drug. That stigma is costing people their lives. And I think that that's one of the most important things that we can talk about that is combating PrEP itself. Because if it weren't for that stigma, a lot more people would be on the drug. And if we can get rid of that, that would be a great contribution today. If we can start the discussion to at least get rid of that stigma, that would be a great one. I think this is the most important thing that I'll ever do, is talk about this drug. If we had given this opportunity to kids and adults back in the 80s, we would have saved millions of lives. They would have taken it immediately. I think that as we all talk about this, cross promotion will breed louder voices. So more people talking about it more often will make the conversation more palatable to audiences that don't typically hear about it. I think that we should all be daring and outrageous in this journey, and don't let detractors take us away from our goal in educating the public and talking about the public. You should be out loud and unabashed in your opinion about the drug and in your taking the drug if you do take the drug. Again, I think it's one of the most important things that I'll ever do. And I'm sure that it may be one of the most important things that some of you guys will ever do. Thank you guys for your time, patience, and love.
Thank you, Martell. And you offer a great lesson, which is just to be brave and go out there and handle it. And I just want to put in a plug real quick for Martell's amazing Prep Squad crew and Prep Squad videos, which I will provide a link for in the resources section of our Hangout. So thank you for that. With that, I'd like to invite our next speaker to share with us a little bit about who they are. And that is Miss Nicole Trainer. And Nicole is a 34-year-old health educator, Bay Area native, born and raised in Alameda, California. Since the age of 8, she has had a deep passion for sexual health. Her personal lived experiences and the lived experiences of her girls has inspired her to pursue a career in public health. Welcome, Nicole.
Can you hear me now? Thank you so much for the wonderful introduction, and I'm definitely more than honored to be on this call and a PrEP champion. So to start, I just want to dive into what it means to me that people out in the world know my PrEP story. So within my personal life, sharing my PrEP story means that Black women have a more powerful voice at the table. Within the field of public health, we tend to only rely on quantitative data for our guidance and where funding should be allocated. We often forget that quantitative data does not capture people's lived experiences. It does not explain the phenomenon that's happening in communities or the phenomenon within the data as well. So sharing my story is a way for Black women to not only have a voice, but have a seat at the table. We know our community more than anyone who's currently sitting at the table. The more I shared my personal story with the young ladies that I fellowship with weekly at the beauty salon where I get my hair done, I realized there was many other women who not only share my story, they share my pain and they share my passion. Becoming open about my PrEP use within my professional life as a health educator working in DPH was definitely frightening. For the most part, this meant that my coworkers who only knew me on the surface was going to know very intimate things about my personal life. One being that I was in an abusive relationship, I didn't have a stable place to live, and my partner was cheating on me with both men and women. But most importantly, I could not bear the devastation I would endure in my current role as a PrEP health educator, sitting at the table discussing strategies to increase PrEP uptake amongst MSM of color and trans women, and I become HIV positive. All because of my profession and the social marketing messaging around PrEP has led me to believe that PrEP is not for me. Local data tell me that heterosexual women who are non-injection drug users are not at elevated risk for HIV, which is one of the reasons why I did not want to believe the truths about what was happening in my life for a very, very long time. However, I became encouraged to share my story during a meeting because I became frustrated with the traditional processes in which was being proposed to reach Black MSM men. I wanted my story to resonate with the people at the table. I wanted them to view the epidemic, the HIV epidemic within the Black community from the lens of a Black woman. So whose fathers, whose brothers, whose uncles, whose cousins, and whose sex partners are at increased risk for HIV. What better way to effectively reach Black men who identify or don't identify as gay men? I also have some things that I wrote down here on tips and ways to really bring not only PrEP champions to the table, but just the community to the table as well. And this is just from my personal experience. One is respecting the community. One of the things we don't realize is we don't provide opportunities for community members to actually be employees within public health. So we want their opinion, we want their feedback, we want their strategies, but we don't employ them as public health liaisons. Why not? Or have programs where they can become public health liaisons. It's an opportunity for them to own ownership. And it's an opportunity for us within the DPH department to build strong relationships. So building community capacity and relationships without time-sensitive objective should be something that's ongoing, should be within our mission within the department. We spend a lot of time and we waste a lot of resources trying to reconnect with communities again prior to us implementing an intervention, which in the end, it doesn't work. It's not sustainable because the community has mistrust and they don't believe in us. We go in, we take information, and we go out. So takeaway message from this is positive relationships bring communities to the table. Thank you so much.
Beautiful. Nicole, I can't stop listening to you. Thank you so much. Everything you offered, I feel like we can do a brand new hangout on. There's a lot to learn. There's lots of ways to bring people to the table. I really appreciate you talking about employing people. What does it mean that we are asking people for their expertise all the time, yet we don't always make room for actual employment opportunities that people deserve? And also compensation. Do we compensate people fairly for the time that we take up in their lives? These are really important questions that we're posing today, and that we'll continue to delve into and answer as time goes along together. With that, I would love to invite my next panelist to talk to us, and that is Marvin Alviso. Marvin completed his family medicine residency in Michigan. He did a one-year postgraduate training for HIV for primary care in Idaho, where he is currently practicing doing HIV care, PrEP, and LGBT health are his areas of concentration. Marvin, welcome.
Thank you, Yemi. Can you hear me okay? All right. Thank you for that introduction. Starting a PrEP clinic came out naturally because there was a need. I am in a very unique position since I'm an HIV specialist who is a family doc by trade. My area of interest included primary care for the LGBT population, and a lot of my patients identify as MSM as well. So I always thought it was a perfect opportunity to start this clinic in rural Idaho and contribute to ending HIV, one Truvada prescriptions at a time. So I've been a PrEP user for 2 years already. My experience navigating PrEP myself has been a nightmare initially. Our program's previous insurance did not cover prophylaxis of any sort. And I have submitted documents after documents about the science and efficacy of PrEP. I even have to disclose my partner's status because we're in a serodiscordant relationship to support my request for approval. Since I think my partner and I will be more comfortable while I'm on it. I knew I can get this medication internationally, so I have to resort that because I didn't have any answers for them. Luckily, I found a Facebook page called PrEP Facts, Rethinking HIV Prevention and Sex, where I messaged some of the members and I look at the posts, and I ordered my first 5 months of generic Truvada internationally. It came after 2 weeks, and then tablets look legit, but there's always that counterfeit fear. So there was that. Currently, the PrEP clinic that I have started have around 65 active PrEP users, and we have 5 who are on and off PrEP. It's an exhausting yet very rewarding clinic, and I'm very thankful for the clinic staff who has tirelessly checked the list, made phone call reminders every 3 months to these 19-year-olds for their PrEP labs, activated copay cards, interfaced with a lot of pharmacy to get the patients work around my clinic schedule. It was a rough start, just like with any other clinic, but now it's like it's really running smoothly, and I'm very thankful about it. The gay community here is small. As an out provider, I've never advertised for the PrEP clinic myself. It was by word of mouth that the patients started to come into the clinic. My PrEP champions are actually my PrEP patients themselves who are starting conversations with their hookups and one-night stands about PrEP, why they're on it, how can they get it, and how they can refer them to me. I'm a sex-positive person. I have a very progressive attitude towards sex and sexuality. Sex is something to be enjoyed. Like a cup of coffee, some like it hot, cold, with cream, with sugar, the possibilities are endless. So when we start talking about it naturally, without shame, without judgment, that's when we can have a real honest conversation about the dangers of unprotected sex and the STDs that are around it. I'm not here to curb any behaviors towards sex. I encourage them to have sex responsibly. Know your status, know your exposure, get tested. If you get chlamydia, I will treat you. It doesn't matter how many times you get gonorrhea or chlamydia. I will still sit down and counsel you about safe sex practices, get you treated, and then go on with our lives. A few obstacles I've had encountered during the clinic is that this 19-year-olds who never see doctors, and I have to force them to see me every 3 months. We kind of like bargain like after a first year, then we can see you like every alternating phone call visits and office visits, but you still need to get your HIV and STD testing done. And then another obstacle I had was STD testing is very expensive. Most insurance will cover only one site for gonorrhea and chlamydia. So talk about another $200 like in addition to clinic lab fees. Fortunately, we do have a nonprofit organization here who do the full STD panel for free. So I do refer them to them. And then for people who move out of state, I do refer them to preplocator.org so they can find providers who can help them start PrEP when they move out. PrEP is just one part of stopping the virus. Treat, test, and get PrEP, I think, is our equation to ending HIV. We all can make a difference in our own little way. By being compassionate physicians or providers, we can gain trust from our patients. And with that trust comes a good and honest physician-patient relationship. With that, I end my talk. Thank you.
Marvin, thank you so much. I think it's so profound how your personal experience has shaped the way you provide care, the way you start your program. And it's such a great lesson to us in the workforce about how we can bring our lived experience, our daily lives, and make them relevant in the work that we do. And it'll only make us that much more effective at our jobs. Also, don't be mad if I steal sex is like a cup of coffee. Some like it hot, some like it cold, and some like it with some cream.
Absolutely.
With that, I'm going to move to my next panelist. There was my timer. And that is Ms. Phoebe Van Cleef. And I will go ahead and introduce you. Phoebe Van Cleef is a sex work activist, a PrEP advocate, and a subject matter expert. Take it away, Phoebe. I'm so happy to have you.
Oh, thank you. Really grateful to be here. So last year I participated in a campaign around trans women and HIV, and I was the person to speak about PrEP. My story is one of millions of trans women's story, being ostracized by family, having to go into survival sex work to be able to do daily things, and kind of like throwing HIV towards the side, something that I really didn't think about, something that I really wasn't like even considering a thought process for me. And what that looks like in the long term is you start to develop a depression, and then you start not to want to get tested, and you start to have questions like, well, if I am positive, do I really want to go and find out? Is this something that I can treat without being like, tested and stuff? And like, so I started doing a lot of research on my own and started understanding, that there are things out there that can help. And then I ended up going into a local drop-in center and started working with the Greater Than AIDS campaign. And in that, I guess, grew from that the video Empowered Trans Women and HIV. And I was really like happy to be able to talk about what PrEP did for me, because it's like giving me a very specific type of liberation. Like it feels very different to be able to say that something that has stigmatized my community specifically is no longer my issue, and that I can inform other people that it doesn't have to be their issue. That's amazing to me. And also like just to know that there are drugs out there that, that can stop the cycle, that can bring down those rates. Like that's what my work is about. So yeah, that's it.
Thank you, Phoebe. Your story is super inspirational to me and many, many other people. Also a shout out to the Empowered video series. It's awesome. It's on YouTube. I will provide the links to that as well. Phoebe, you are a ray of light, and you light up a lot of people's lives with your storytelling. Thank you. All right, on to my next panelist. We will now hear from Raul Quintero, who is a sex-positive PrEP and HIV advocate, navigating underserved priority populations into care as lead PrEP navigator for Wesley Health Centers. Raul is also chair of the Los Angeles County PrEP Educators and Navigators Group, or LACPEN, partnering with frontline staff countywide to build skill sets and develop best practices to best serve everyone seeking biomedical prevention care in Los Angeles. Welcome, Raul.
Hi, thank you for having me. I honestly am honored to be here. Can you hear me? I'm honestly blown away to be among such amazing advocates. My story, this week I was seeking where is the source of my power and why do I do what I do? And I realized that the source of my power is sex negativity. It's slut shaming. It's HIV stigma. And it's wanting to combat that. And it kind of, we hear a similar theme across the board. But it also came from the word no. It came from lack of information. 2014, I was working with a well-known ASO in their marketing department as social media coordinator when controversy started to surround one of the exec board members and the information that person was putting out in the press around PrEP. And they became a big adversary to PrEP awareness. And I was one of the few people in the marketing department who maintained that PrEP is a viable prevention option. I opened up and said that advertising was either sex negative or slut shaming or stigmatizing to the community we were serving. And eventually we split ways. And as a big FU to them, I actually tried to give a PrEP presentation at a well-known sex positive conference called Catalyst Con. And it didn't go so well. And I always say failure is my best friend. I had 6 people. Actually, you know what? It wasn't a failure because there were 6 people who didn't know about PrEP in my first audience, and it taught me that I need to learn a lot more. So I learned a lot more about PrEP, and at the end of 2015, I took on the new role as PrEP educator at the organization I'm with now, JWCH Institute, Wesley Health Centers. And I utilized that knowledge that I acquired, and I utilized the previous skill sets I had as a marketing, advertising person, and utilized my social media skills to then develop a social media brand online on dating app profiles called the PrEPucator. And I took that information to the streets. I took it into low socioeconomic neighborhoods. I took it on virtually and I started having conversations about PrEP. And it wasn't something that I invented. It was already something that was being done grassroots level in the community. And I went ahead and I just capitalized it and I utilized it for an organization. And through that, I have reached hundreds of low-income people of color, people at risk for HIV acquisition, to inform them about PrEP and that it was available to them in Los Angeles for little to no cost, and that it was a viable option for their lives. And I'm blown away to do the work that I do and to be with an amazing organization where I no longer hear no, 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 but if you can do it, yes, yes, yes. My biggest advice, for those of you on the ground who, you are your biggest PrEP champions. If you're not an organization, you have the opportunity to be a PrEP champion within your community. Inform yourself and educate yourself on scientifically backed info. With any tool, you can spread information to those who want and need it. Learn where to refer people for local resources. Have a passion in what you do because doing it half-assed is not beneficial to anyone. You don't need money. There are plenty of free tools on the internet and on your phone for you to discuss PrEP. Respect other people's views on PrEP. And always back what you got to promote with facts. Misinformation is worse than no information at all. And then for those of you who are in organizations, you are part of a team. We use the champion analogy, and champions are the sum of their coaches' teachings and their teammates' teamwork. I wouldn't be here if not for my mentors, elders, teachers, and coworkers and their guidance and support. Always bring your A game and know that what you do, it's quite Sisyphean and the work is never done. And it's something I used to use in marketing, but my biggest advice is remember, success is not based on one good campaign alone, because there will always be more obstacles and challenges to tackle. Thank you for your time.
Raul, thank you for so beautifully weaving your personal experience in life into your work life, your work experience, and really bringing that to the table as you develop programs and campaigns and making them effective. So shout out to PrEPucator. I will also provide a link to the social media profiles for PrEPucator on the list of resources. Thank you for joining us from LA. Next, I will hand over to Christina Palacios. Christina is a 34-year-old African-American and Latina female from Oakland, California. She is a psychology and community social services student and is currently on PrEP. Hi, Christina. Christina, we don't hear you, so why don't we come back to you and you can figure out your sound? We don't hear you. Okay. I think I will come back to Christina. Let's go to Caleb Barton. Hi, Caleb. Caleb Barton is an executive committee member of the National Youth Forum on Homelessness and the vice chair of Young Black Gay Men's Leadership Initiative. Currently residing in Washington, D.C. and working as a prevention program coordinator with Us Helping Us, Caleb feels passionately about youth empowerment. He continues to use his platforms to bring more awareness to social health disparities affecting youth and people of color all over the country. So happy to have you, Caleb.
So happy to be here. Hello, hello, hello. Thank you all for joining. So in my experience as a PrEP program coordinator, I spend a lot of the time traveling and training individuals on PrEP education, kind of at people who have like a nominal level of understanding of prevention. And so a lot of the time that is me speaking to medical service providers like nurses or nurse practitioners about what PrEP is and what the options are. And something that I find most alarming is the views that they have on PrEP, and to the previous speakers about the lack of sex positivity that they have. Even more so, I believe the level of homophobia and misogyny that exists in the medical field, because there is this belief that individuals who are trying to access PrEP, that they are just doing so they could have condomless sex, or that they could feel free and have as many sex partners as they want. And I feel that if that's what their choice is, if that's how they want to live their life, then they should be empowered to do so. But a lot of medical service providers have made it very, very clear that if they do have a client or a patient that does not want to use condoms, or they feel like they're going to have high risk sex, then they won't prescribe them PrEP. And I think that this is a big problem that we need to start to target. We need to start to work with medical service providers and get rid of the homophobia and misogyny that exists in there. Because in other terms, when you're thinking about birth control and the history of birth control, initially it was kind of looked at as a slutty drug or something that women could use to be sluts or whatever. And as it evolved, more medical service providers realized that this was a thing that was going to keep women to help women protect their bodies and have the ownership and liberation over their own bodies. And I think that we're probably going to see the same thing with PrEP, but we just need to work with those medical service providers while they are in school and not when they are already doing the service, to be able to understand that it really is a barrier if they feel that if their client is trying to be sexually liberated, that they should not access this medication. And it does nothing for us to end the spread of the virus. Additionally, one thing that I try to make sure that I reiterate whenever I'm doing these trainings is the barriers that exist. Because a lot of the times, although we may have a working knowledge of the social determinants of health and those things that come into play whenever we're trying to access PrEP, a lot of individuals, including medical service providers, feel that some people just don't care about their health. And in my experience, I believe that everyone wants to live. They want to live a very long and healthy life. And majority of the time, and even in those individuals who are, maybe suicidal, they still have the desire to live, but it's because they feel like they can't go on. And so whenever I'm speaking with them, I have to reiterate the barriers that exist, understanding the levels of oppression, understanding the ideological levels of oppression and how that goes into racism and sexism, classism, homophobia, and how that feeds right into the institutions like their medical office or the schools or education. And then how that feeds into our interpersonal relationships and how then our clients begin to internalize our feelings. And we have to understand exactly how that system works in order to be able to combat the virus. It's going to take a lot more than just prescribing individuals PrEP in order for us to see the end of HIV. We have to also acknowledge the social determinants and adopt a housing first model as a prevention tool in order to really see the end of the virus. One thing that I make sure I reiterate is that if we don't have the basic needs, the shelter, the food, then I can't you can't expect me to prioritize my health. The last thing that I'm thinking about is taking a daily pill or adhering to seeing a doctor if I don't know where I'm going to sleep. And in my experience dealing with queer people of color, that is a lot of the times the issues, being that, based on lack of acceptance from their families or whatsoever, they are, not able to really see themselves going through this this biomedical intervention because there are so many other barriers. So like I said, we need to make sure that we work with the medical service provider industry to really lower their barriers and educate them on what homophobia and misogyny is. But we also need to work with ourselves to understand what are the social determinants that are keeping our clients from being able to access this drug. Because in the end, I know for a fact that if we are able to remove all of these barriers, make things low barrier, then individuals will be able to access PrEP at a greater number.
Could you just find a mic and drop it one time, please? Caleb, thank you. You provided so much perspective. You provided so much background information. Some of the things you said that are so poignant for me are the fact that as providers or as people who work in the front line as case managers, peer advocates, it's so important for us to understand systems of oppression and how they seep into our personal interactions with our clients, with our patients. How do we behave as patients also? This is really, really important. I feel like I'm going to be replaying this and learning from it for months to come. Thank you so much for joining us today. With that, I'd like to invite, I'd like to just try and see if Christina's mic is working. So let's see.
Can you hear me now?
Yes.
Awesome. I'm going to turn it all the way up so I can make sure everyone can hear me. Okay. All right. So once again, my name is Christina, and I'm going to take these earphones off since I'm using the microphone. I just want to say how grateful I am to be here today. PrEP is a really wonderful thing. Currently, about 468,000 American women can benefit from this drug. I think I was about 11 or 12 when my mother tested positive for HIV. And ever since then, me finding out that it was such a preventable disease, it's been a passion of mine to make sure that as many, especially women of color, increase their self-esteem, because when you know better, you do better. Sometimes we have the information or education, but we don't use it. We don't apply it. So harm reduction is one of my really big interests. So I've been volunteering with different organizations since I was about 12. First, the Center for AIDS Services, also World, APB, CalPEP, Amasi, all these wonderful places. And there's just so many resources in America in general that we don't use. And I just think, PrEP is just a wonderful thing. I was introduced to PrEP a few years ago. I was on in a focus group. And it just seemed kind of far-fetched to me. I'm like, how is this one pill going to prevent HIV? And I did some research, and it seemed like something that I was interested in and something that will really benefit me. So I would say about 9 months ago, I started using PrEP, and I've been using it ever since. I am a bisexual female, and I enjoy sex. I'm a sexual person, and condomless sex is something that I partake in from time to time. And I just think that it's better to be safe than sorry. I do get tested regularly for HIV and for STDs. My partner gets tested as well. But hey, you're not with your partner all the time, so you never know what that person will do or who their partners are doing. So anyway, like I said, I take pride in being a woman of color and being a strong woman. And so PrEP kind of helps me with that. I'm a very social person. I'm a very open book. So I think using my platform to educate other women about their sexual health and their freedom and their rights as a woman, I think it's just awesome, because some people are scared, or, the stigmas, they're shy, or they don't know who to go to for help. So I think these wonderful people on the panel are great, and you should just use our voices to save lives. I'm a former sex worker, and if I knew about PrEP back then, I could have saved a bunch of lives too, because I could have, told a lot of women about it. There are a lot of women in my community that I used to run with. We used to party, do drugs, do sex work, and it's sad that a lot of those women are HIV positive now. And I just think if people had more access to PrEP, then it could, like I said, it could save lives. In Oakland, there are several methadone clinics. And I think that if we could have like a PrEP clinic where people could access their medication, and that would be awesome. Because like another panelist was saying, some people don't even know where they're gonna sleep that night. And a lot of people are sleeping in tents, sleeping in hotel to hotel, getting arrested and losing all their belongings. So I think maybe if they could get like a week's worth of PrEP at a time, or even daily if they needed it, they could have a safe place to access their PrEP. If anybody's wondering, this is what it looks like. Comes with this nice little Truvada bottle. Here's the pills here. I don't have any water. I'd be taking my PrEP right now. Anyway, I'm gonna wrap this up, but I just want to say that if someone is thinking about using PrEP, it could save your life. And if you're not ashamed, not scared, use your voice, get educated, and spread the word. It's not for everyone, but if it is for you, go ahead and do it. Thank you.
Christina, I appreciate you so much. You are so brave, and you really walk into a room and you tell your story like everybody better listen, and I love it. I love it, and I know a lot of people learn from you and appreciate you very much for that. Christina, I just want to put in a plug for the Hive blog, which Christina has written for a couple times, and as has Nicole actually. We feature personal stories and life stories of folks affected by HIV in whatever way. And so go check it out. It's really awesome. Again, if you would like to join us on Twitter, go ahead and use the hashtag #PleasePrepMe. And if you have questions for our panelists, ask them in the YouTube box or text them to 415-842-2722. And with that, I'm actually going to invite my last but definitely not least panelist, John Byrne. John is a Miami PrEP advocate and co-founder of the Prevention Access Campaign, a nonprofit that's focused on improving access to biomedical HIV prevention and empowering those most affected by HIV with accurate and factual information. John, thank you so much for joining us.
Thank you. Excuse me. Thank you. Frog in my throat. I'm actually going to change my story a little bit because people emphasize so much of their personal story, and it made me think about things that had happened in my own life and why they were important. I started on PrEP in 2015, and actually the first doctor I went to told me to tape a condom to my leg when I asked for it. I found another doctor, but I thought if I, as a well-off white person, am having this kind of problem, like everyone is fucked, basically. And so that sort of opened my eyes. And then the second thing that happened to me about 4 months in, I had a false positive HIV test, and it actually happened twice in 2 successive days. So I was confident that I had HIV. I started reaching out to people in the field. And it takes a while to get the confirmatory results back. So, that was a transformative process. And then I became acquainted with Miami's HIV statistics. I don't know how many of you are familiar, but Miami leads the country in new diagnoses, has 3 times the national average. And I just thought, why is nobody promoting PrEP? Why isn't anybody doing anything? And one of the things that happened, I have a background in journalism, and people encouraged me to write about my personal story. So I wrote an article for The Atlantic for World AIDS Day in 2015, where I came out as being on PrEP and loving having bareback sex. And this was something, my grandmother, my 85-year-old grandmother saw this article, my family, my friends. And it started a lot of conversations, I think, among my friends. I had no idea how few people were using condoms. You know, I think after having conversations with my sort of extended friend network, I probably found 2 people who were consistently having condoms. And one of those people subsequently came to me for post-exposure, knowing that I was doing the PrEP advocacy later on. So that number came down to 1. And I just thought, in this world where, you know, all of us in HIV prevention are throwing condoms at everybody, you know, and we're seeing so many new infections, there has to be a better way of doing it. So for me, you know, I found that authenticity about being honest about my sexual experience really brought a lot of people to me for PrEP, and to have more honest discussions about their sex lives, because, you know, so many people are being told to use condoms and they have such a hard time talking to that prevention specialist because they know that person is not doing it, you know, and they just, that's not their experience, and they feel ashamed, you know. So that authenticity I found was really important, and both in bringing people in and starting the conversation. And, you know, even I have that conversation, I do some medical provider trainings, and I mean, I don't, you know, go and say I'm a bareback whore to doctors, but, you know, I'm pretty upfront, and I know there's the guy that runs PrEP Facts, who many of you know, Damon Jacobs, and he's very upfront about it. And I think that authenticity really, really helps. And so you should cut me off at some point because I moved a lot of stuff, but I want to give you a few other things. So after that, what I decided to do was run my own campaign in Miami. I was inspired by Peter Staley, who was the initial funder of ACT UP, and who did a campaign against crystal meth in the early 2000s. And what he did is he just put ads on telephone booths, you know, buy crystal meth, get HIV free. And so he just said, just go do something. So initially I shot my own campaign. One of my exes is a model, one of my exes is a photographer, which was really convenient. But what I ultimately saw is that there were better existing campaigns, and that it was more cost effective to license things that existed. You know, for a market like Miami, there's no extra money lying around. So we licensed Swallow This from Harlem United, and then a brochure that was done by Legacy Community Health in Houston. And reusing those campaigns was a really powerful way to, you know, I probably spent overall like $10,000, but, you know, we put out 12,000 brochures to clinics, we supply brochures to the health department, and we were able to do it without spending, you know, I mean, it's not cheap, but it's not the kind of money that you would need to mount, you know, full-scale advertising campaign. Like Raul, I also did some of the PrEP work on Grindr, where I took questions. That's obviously free and very effective. So many people I just go on and I can't even stop talking to people. I was always surprised. And then, you know, another thing that we're focused on, and I think you can do as a community member, even if you're not a health clinic, is push people to open PrEP clinics. Federally qualified health centers have money that they should be spending to do it from their prescription drug programs. Colleges and universities here in Miami, University of Miami does a lot of HIV research, and so is interested in funding things like that. And even, you know, I went to a big gay donor who helped get the mayor elected, and we're going to go to the county and be like, you know, listen, bitches, you know, you have this problem and you want something to change, you got to spend money. So we'll see how that goes. But I really think just kind of being a thorn in people's side and being authentic about your lived experience makes a huge difference. That's my story.
Thank you so much. I really want to shout you out for utilizing the resources that are available to you and making something big happen. And we all have that ability. We don't all necessarily have the same resources, but it's important to do what we can. And thank you for doing that. I also want to shout out the work of Prevention Access Campaign and the U=U campaign, Undetectable equals uninfectious. So thank you for that work as well. It's really important as we move forward in PrEP. Also recognize people living with HIV throughout the world and support treatment and support reaching undetectable as an integral part of ending HIV transmission worldwide. So thank you for that also. with that, I will actually open up for questions. This panel just blows my mind, and I know that there's some questions out there waiting for folks. I want to start with the first one being about young people. Sarah Jackson asks, how can we get the young people to realize that PrEP is available and it works? And I'm wondering if I can direct this question to a couple of people, but maybe we'll start with Martel. Martel, you got any thoughts on how we can reach young people with PrEP messaging?
Make it sexy. So that's exactly what I try to do with my content on Instagram and YouTube. Make it provocative. So like the video link that I sent you guys was titled, "Does PrEP Let Me Fuck Raw?" So with that kind of title, I'm going to grab someone's attention, and then they're going to listen to what I have to say, even if they don't know exactly what the content of what I'm going to say is going to be, what the title of the video is. So be provocative, be sexy, because that's what they pay attention to.
I think it's such a good point that in this world, we got to make it sweet, short, and just get it to people quick, fast, and in a hurry. And definitely your videos do that. So thank you for that. I'm thinking, I wonder if Caleb, could you shed some light on this?
Yes. So when I'm working, what I do is I have a Preppy campaign. Well, it's called Preppy. Shout out to Preppy. But when I have been trying to engage youth, I think that you definitely have to find what is current and what is working for that group. So specifically in my experience, I work with predominantly Black people, Black LGBTQIA identified individuals. And in that community, what we have is the ballroom scene. And PB and I both are a part of the ballroom scene, and that is like the house and voguing scene that you might have seen on Paris is Burning, or that you might have seen in a Madonna's Vogue video. And so what we do is we will throw a ball, and we will host that in collaboration with the ballroom community from our area. And at that ball, we will provide them with testing. We'll provide them with case management services, and additionally, typically at those balls, they're for competitions and they go for prize money and everything. And so in order to be qualified, in order to get, what happens is the more people who get tested for STIs and HIV, the more money that goes into the pot for the winners. So it doesn't, of course, require anybody to get tested to come to the event. That's open to all people. But if they want more prize money in their category, then they'll come in, they'll get tested, and they'll also get PrEP counseling at that point. So the main thing is just finding whatever is current. Also to note that whenever Pokemon Go when it first came out and it was a big thing, we got right on that, and we threw a Pokemon Go event, and we threw it in the park, and we paid for the lures for them to bring Pokemon, and we called it PrEP before you poke. And so we had individuals come, and based on that name, that was already an attention grabber for them. But then also because that current trend of Pokemon Go, we were able to get a lot of people to come out. So my suggestion is just go with whatever's current and trend.
Cool, thank you so much. While we're on your camera screen, Phoebe, you got anything to add to that about how to get PrEP to young people? If not, it's all good to pass.
So for me, I think that one of the bigger things is just to make sure that the people that are actually providing the services are truly trauma informed, and then also just to make sure that people kind of check their own egos at the door, because I know coming into situations where you need services, and then you're dealing with someone who feels like they're already it seems like they're already better than you, or they feel a way. It's it doesn't make me want to go anywhere. And then also making sure that your services are affirming to trans, gender nonconforming, gender expansive, two-spirit people, because those people need those services. But when they don't feel affirmed, they're not going to come where you are. So
thank you so much. I'm wondering, Marvin, do you have any perspective from the sort of doctor-provider perspective on how to best reach young people in a clinical setting?
I don't deal with too much kids, but when I do, especially adolescents, I have that conversation again. Like it stems with being sex positive. Like I know it. Like they'll blush like first time around when I ask them about like their sex habits, but I think it's them coming to the clinic, having that conversation without the parents, hopefully. Sometimes they still do, but like and then like the parents do come out. But having that first conversation with them and then defining them, like asking them how like. Are you sexually active? And like asking them define to me how sexually active you are, and then we can have that conversation. And if there's like risky behaviors, and then if they're started to dating, then I try to tell them like how to start using condoms. And then like I haven't had that chance to discuss PrEP because I haven't had any well childs with like 16 to 18. But when I do, I think I've already in my mind will have that conversation to be more sex positive and not to shame them. And if they do, let's protect you. And if you do get like any STDs, then let's get you treated.
Cool. Thank you. And I'm sorry for putting folks on the spot with answering these questions. I'd like to take another question from Carlos at the Cascade AIDS Project. And the question is about accessing PrEP for folks with a really high copay. Now, this is a complicated issue and it's different in every state, obviously. But Carlos said some folks have like $400 or $500 copays. Does anyone have experience with like walking people through accessing PrEP insurance wise? I know that there's a PrEP access guide that we'll host on our website that I will add to the link section that can help folks with the process. But does anyone have any thoughts on that? Maybe, Nicole, do you want to say anything about that Project Inform chart?
So can you hear me?
Yep.
So Project Inform just updated their how to get PrEP access sheet, and it's an informational sheet, and I think this is very useful for providers and for individuals who want to access PrEP, being that PrEP is constantly evolving and we're not sure with this political environment with the Affordable Care Act what's going to happen with people's access to PrEP and co-payments and so forth. But I think this is very descriptive, and it's a great guide into helping people access PrEP. Another thing, here in San Francisco, we have some really amazing PrEP navigators. So even within your city, if you can access a clinic who have PrEP navigators who are similar to Benefits Navigation will help individuals get on PrEP as well. So if you don't have insurance or if your co-payment is really high, there are other resources like the Gilead Assistance Program to help with those large co-payments. In addition, I just wanted to add for the youth piece of it, in addition to all those creative ways to get people, youth interested in PrEP, another core piece is ensuring that you have the resources to provide individuals who are under the age of 18 with PrEP access. And currently right now, the FDA has not approved PrEP for individuals under 18. We recognize that here in San Francisco, and one of the things that we've done was we funded a pot of money to SF General Hospital that's only for PrEP use for youth who are either 18, if they're 18 to 24 or under 18, so it's 15 to actually 24. And we supply PrEP to individuals who either have insurance but don't want to access PrEP through their parents' insurance for confidentiality reasons. They're under the age of 18, so they don't qualify for Medi-Cal, and they also don't qualify for any other Gilead Assistance Program. So it's essentially a safety net allowing individuals to access PrEP, and hopefully within that time, FDA will have approved PrEP for youth during that time. So that's just something to keep in mind when we're promoting PrEP. Ensure that your organization or within that city, people under the 18 have the resources to access it as well. So that's my 2 cents.
Thank you, Nicole. Thank you so much for chiming in on the youth question as well. I'm going to take a last question and then we're going to wrap up because unfortunately our hour is over and I can't stop talking to these people in this hangout room, but we're going to have to shut it down pretty soon. One other question was actually about homeless youth. I guess it applies to homeless folks, people without housing in general. And the question was directed to Caleb, but I wonder if others can answer too. Can you give any advice for providers working with homeless teens on where teens can stash their meds? Caleb, do you want to start that off? And then maybe Christina, can we hear from you on that?
I think that if you do have an office that that any type of youth frequents, then you should definitely offer that space as a space for them to stash their meds. Also, if that, because I do understand that, you know, a lot of times spaces are only open specific days, maybe Sundays when not one of those days. So also offering them little capsules, keychains and things like that. I know that a lot of the times people think that those are a little cumbersome, you know, maybe they don't work out, but in my experience, it does help me always be reminded of, you know, to take my meds because I have it every single day attached to my keys. And I think that additionally, the biggest issue that we encounter with this is even more so. Oh yeah, she just pulled it up over there. Her little, yay, little capsule, little pill capsule. So those.
.org.
Yeah, those exist. You can get them for free. They're awesome. Give them to your clients. But also, I think the bigger issue that then comes in as far as like the insurance is concerned, and that report that comes out if they are on their parents' insurance. And so in my area, because I'm in DC, we have worked our way around that by going through the Department of Health to be able to fund getting PrEP and getting access to PrEP. But I know that some individuals won't be able to do that. So I encourage you to work with your local departments of health to see if they have any options for youth that are trying to access PrEP that are on their parents' insurance. And additionally, in the meantime, just working with the youth to make sure that they understand that that is a liability that may happen.
Cool. So actually, I'm gonna ask this last question, and I'm gonna ask it to Christina. So this question is about PrEP awareness campaigns for women. There aren't a lot of PrEP awareness campaigns for women out there. What can be done? What suggestions do you have for better advertising for PrEP for women? And I'm thinking Christina might have some thoughts on that.
Yes, I was working with Pangea and also World, which stands for Women Organized to Respond to Life-Threatening Diseases, and they're both out of Oakland, California. Unfortunately, Pangea is shutting down next month because of funding or whatever. But anyway, actually, as long as you have like an advocate or someone who is educated in PrEP, like you can start up your own. There's like a lot of funding that you can start up your own campaigns. Also, I would go to hive.org and go to Hive HIV online. They have blogs where you can connect with other people that can give you information. Also, you can go to AIDS.gov and they have a lot of information for about PrEP and HIV awareness and prevention. If you go to Hive, they can also provide you with these little cards that are discreet, because a lot of people don't want a big pamphlet or, you know, big billboard about HIV awareness because of the stigmas or because of whatever reasons a lot of people are scared. But yeah, like just go, there's a lot of organizations and places online that you can go and get more information.
Thank you. I also want to quickly shout out, thank you for the shout out to Hive, by the way. I also want to shout out, we did a hangout back in November of various PrEP awareness campaigns that have included women. Some, like for example, PrEP for Love, PrEP for out of Chicago, PrEP for Her out of DC, the New York Clay Shore campaign. Of course, our blog that I talked about, the Hive blog that I talked about also. With that, I have to shut it down, but I do want to ask each of my wonderful panelists if you have one last thing to share, one tip that you would share with our audiences about how to meaningfully bring people to the table. If you have something to share, if you could just like raise your hand for me one time. Anyone? Christina?
Okay, I just want to say that whatever you have a passion for in general in life, just go for it. Keeping information inside is only harmful, not just to yourself, but to other people. So if you have good information, share it, because you never know who might can relate to you, and who, you know, you can save a life. That's about it.
Thank you. John, I think I saw your hand also.
I had two things. One is don't be, I mean, the power that you have is more than you think. And even like doing from the beginning, just doing the grinder education, I knew I was reaching, 10 people a day. And if one person from that 10 people, actually followed through, that made a huge difference in their life. And then two, don't be afraid to call people out. I mean, I hear you guys talk about your health department's funding programs, and it just makes me laugh because of, I had to go and like drag people kicking and screaming to make sure things were getting done. So don't be afraid to go call people out who are in positions of power that have the money or the resources or the access.
Awesome, thank you. Caleb, Phoebe, anyone wanted to add any last things?
Just to be really open-minded with your approaches as it pertains to people who don't know about PrEP, getting stuff out there, marketing. Just be really creative, and yeah, that's the best thing for me.
I would just add, never mention PrEP without mentioning treatment as prevention.
Thank you. Martel, did you have any last comments? Superman, rather.
No, definitely what everyone else said is in tune and in line with the way that I carry myself as a PrEP advocate and the way that I want more people to be knowledgeable about the subject and to reduce the stigma around the subject.
Thank you for all your service. Marvin, any last tips or comments?
Just like with anybody, and I always put myself in like patients' like shoes. So like I want to be treated. I mean, I want to treat people like I want, how I want them to treat me. So whenever I have these conversations for PrEP, for HIV, for treating, or even like preventing, I would just put myself in their shoes. So that's just how I live my clinic day to day.
That is actually a really simple and a really powerful tool. Thank you for reminding us about that. Nicole, any last words, any tips?
Yes, I don't want to have Caleb's messaging. He articulated this very well in regards to addressing social determinants. And this particular message is specifically for agencies who provide direct services to communities, and particularly the DPH, Department of Public Health, who directly fund those agencies, is that we cannot expect to get to reduce HIV rates, in particularly communities of color, if we don't have efficient wraparound services to address housing, food security, and employment, and that we are ensuring that we are employing people from the community with efficient salaries. I think that's what we should end with, and it's a great take-home message that we can't forget as providers, that that's where funding really needs to be allocated. And Caleb, kudos to you for articulating that very well. Thank you.
Thank you, Nicole. Raul, any last tips, words, thoughts?
My last tips are actually for people outside of organizations. Remember, you have the ability to use your voice. Join a community advisory board, attend your local HIV commissions meetings, volunteer at your local outreach events, just be an advocate among your group of friends. Just remember, one person with resources is a victory, and that's one possible less seroconversion. So just get the information out there. Just basically, you have the power. Never, ever, ever underestimate your power as a person and an advocate.
Thank you so much to my panel. I definitely just want to highlight again, it's so important to bring people to the table and include people in the conversation in a meaningful way and not do it as an afterthought. Compensate people for their time, create employment opportunities. Really just one more PrEP prescription is better than one less. And so when we have small numbers, it's okay. It's important, the work that we do with each individual. Thank you all for taking the time to be here with me today. There's so much work to be done, and you are already on your way. And I will end on that note. This was Hangouts with Hive.